Today we're going to be talking about arthritis. I want you to keep in mind there's two groups of arthritis. One is osteoarthritis, which we say OA, capital OA. Osteo means bone arthritis. It's an arthritis of the bone. We also have rheumatoid arthritis. Rheumatoid arthritis, or RA, is part of a group of arthritis that are systemic. It includes gout, lupus, scleroderma. It more affects the system of the body. For instance, I have a handout here. It shows a normal joint here on the left side. What you see are two bones. You see cartilage between the two bones. The joint is covered in a synovial fluid. The fluid is very viscous. It's a thick liquid. I kind of say like oil in a car. It keeps everything very lubricated. That osteoarthritis is shown here on the top. What happens with osteoarthritis, which is the most common type of arthritis, is the cartilage wears down. As the cartilage wears down, you start to get more bone on bone. You do get some bone spurs happening, you get some little bony growth going on, so you get bone on bone, you get that irritation, the soreness, that swelling, pain when you try to move those joints. Osteoarthritis is also called the wear and tear arthritis. Overuse. Hands, it happens a lot because we use our hands frequently. You'll see it in the tip joint and the middle joint. We get this little bony growth. You see it a lot in the base of the thumb. From the overuse, the back, the knees, and the hips are also very common also. We find that about 27 million Americans have osteoarthritis. Most everyone over the age of 60 has some type of osteoarthritis, again, because it's a wear and tear overuse arthritis. The other group, again, like I said, includes rheumatoid arthritis. It's systemic. Looking on my handout, it's the bottom. What happens is the body gets a little haywire. It attacks itself. The immune system attacks the synovial fluid. It wears down the joint, so what you get is swelling, pain, soreness, warmth to the joint. It tends to be symmetrical. It happens in both sides. It happens in about 1% of our population. Females are 2 to 3 times more likely to get rheumatoid arthritis, but when the male gets it, it tends to be more severe. Rheumatoid arthritis a lot of times can be hereditary. You can also have a blood test done to see if you're carrying any of the symptoms, any of the signs of the rheumatoid arthritis. Moving on, what I want to talk about then is how therapists treat the arthritis patient. Now, starting off, a lot of times when I first see them, they come to the clinic, they're painful, they're swollen, they're stiff, they ache, they don't want to move. I find heat works really well. It warms up the joints, it increases the blood flow to help with healing. The best product out there is the paraffin. It warms the hand. They dunk the hand in the paraffin. It's a warm glove to the hand. It gets all those little joints. It feels wonderful to both your osteoarthritis and your rheumatoid arthritis patients. Now, sometimes paraffin can get a little bit messy in the home, so I find second I like are going to be the meta beads. What's nice with the meta beads is you warm them up in the microwave, you take them out. Now, this is the mitt to keep the hand nice and warm. Comes in different sizes and different shapes. It gives a moist heat. The moist heat tends to be more effective for the arthritis hand than the dry heat or just the electric heating pad. If you have arthritis in the back or the knees, heating pad works fine, but I find for the small joints in the hand, the moist heat works better. Once in a while, I do get a patient that comes in and they have an acute flare-up, usually more in the rheumatoid arthritis patient. Their knuckle joints, the MP joints are swollen, they're red, they're warm to the touch. That's the person I will use cold to calm it down. Again, we have the Norco cold packs that work well. This one is large. This would be more for the knee or the back. For the hand, I would prefer a small one because I don't want a lot of weight on the hand. You can use it in the refrigerator for the hand, freezer definitely for the back, the knees, or any of the larger joints that you have. Along with the hot and the cold, as therapists, we do a lot of patient education. We look at joint protection, energy conservation, balancing work and rest, joint protection, using larger joints whenever possible, using both hands when you can, energy conservation, combining one or two steps together if you can, also taking breaks throughout the day. Patient education is a huge part of what the therapist will do with the patients. Moving on though, I do want to spend more time and focus on the orthotic devices. There's a variety. Now, that patient comes in and they just got that painful joint, they're sore, they just want to hold and just be taken care of. The iMac arthritis gloves are awesome. What you do is you slide them on. It's a very soft material. It hugs the hand. It has the tips open so you still have fine dexterity so you can use these functionally. It feels really good. We also do have the Norco Therapeutic Compression Gloves that work really well also. Again, they give light compression to the hand. We have the Tipless and we have the full finger one also. Nighttime tends to be a time where patients really can benefit from wearing an orthotic device. Typically, we sleep curled up. If I do this, I'm going to irritate the joints again and the tendons crossing the joints. So at nighttime is when I want to keep the person in a very nice, neutral, rested position so they can heal their hands so they have better use during the day. For the arthritis patient, I really like the 3-point product here. What it has is a very nice soft material, which is important for a lot of the skin integrity of these patients. What I'm going to do is I slide it on. I have nice stretchy straps with an O area here that I can pull around and just easily attach because I don't have a lot of fine finger dexterity. I have pieces here that I bring around to support the wrist. A lot of times the arthritis patients, they start to get a zigzagging. The wrist starts to drop this way. The finger joints, what happens because of the swelling going on, the tendons tend to drop over to the side and you'll notice the patient's fingers start to go sideways. We call that ulnar drift, ulnar deviation, going over towards the ulnar bone of the forehand. Painful when they do that. So this one, when they slide it on, they now take these little stops, line them up around each of the fingers to help keep the fingers nice and straight. The finger joints can be left free because they're usually not as affected with the RA as some of the other diagnoses are. So this gives them some freedom of motion. They can pull up their blankets and they can still use their hands. Very comfortable nighttime orthotic device. During the day, for the patient, the rheumatoid arthritis patient that just is starting to get arthritis, if they start to use their hands or seeing the fingers go through that ulnar drift, the small Norco ulnar drift orthotic is excellent. What you do with this one is you wrap it across the palm. These finger pieces, they're going to go between the fingers to help straighten them out. I take the first one, I come around and I pull towards the thumb direction. Second one, I pull again towards the thumb, go around the ring finger, and now I go around the little finger. It straightens up the finger, gives me full function. Great to use during the day, doing household chores, doing some gardening, some sweeping, driving. Excellent, lightweight, small orthotic device. For your osteoarthritis patient and some of your rheumatoid arthritis patients, the Comfort Cool Restriction Splint works excellent. This is the one we have talked about before. That goes comfortably around my wrist, gives some light compression, and then I have this extra support at the base of the thumb where I pull around and pull the strap over here. It allows nice motion. It gives me the support where I need it at the base of the thumb. And here I may cut this a little bit so that my IP joint, the tip of the thumb, is free to move. If the person is a little bit more involved and needs to have some wrist support also, we do have the thumb wrist support, the CMC restriction splint. It has, again, that great strap that has the open here so that you can use it one hand, pull it around, and give extra support at the wrist. You may get the patient that comes in and they just want a little extra support at the wrist. They're still moving, but they need something. The Liberty lace-up orthotic is excellent. Again, a very soft material. It feels comfortable. You slide your hand in. With these straps, it makes it easy to tighten it up. You pull around, attach the Velcro. Again, pull around, attach the Velcro. Done, it's in there. It's not a lot of small pinching that some of the orthotic devices require. Very, very comfortable. If the person needs a little bit more support, we do have the Norco D-ring orthosis. This one, similar. It's very soft material. It's very comfortable. What I'm going to do now is go ahead and pull the Velcro around to give myself some nice light support. Soft, comfortable, allows finger and thumb motion. For that patient that just needs a little bit of thumb support also, we have the Norco thumb wrist support. Again, soft material, which is very comfortable for your arthritis patients. I'm going to slide it on, nice long straps, tighten it up, and then I have a thumb piece here that comes around to support the base of the thumb. These are excellent products to use with the arthritis patients. There are some other ones. We will continue our next discussion on some of the ADL products. Thank you very much.